Betsy Baum, the medical director at Bethany, and I really want to take a brief opportunity to talk with you about the COVID vaccine. Abby did a great overview about the COVID vaccine last week, and what I'd like to do is follow up emphasizing the most important points that she made, and I want to make the points both personally and scientifically. First, the personal. I actually got the COVID vaccine today. I preferred to wait till next week when we're having it available the first time at Bethany, but unfortunately I'm getting chemotherapy for cancer up at Cleveland Clinic, and I'm going to be there next Monday. The good news is I'm almost completed with the chemotherapy and I'm doing quite well. So just to show you, I have, it says, knock out COVID, I got the shot. It was pretty simple. So what I'd like to do personally, I would like to thank each and every one of you for all the wonderful care you provide to the residents at Bethany every day. A lot of times, families may say something to me about thanking me for the care, or a family member or the resident themselves. And my first response always is, we are so blessed to have such a wonderful staff, because it's really the team, which is each and every one of you, that provides the care that we're all so proud of. The other thing I think we've always, unfortunately, all shared lately is a lot of pain and sorrow, because it is so hard when the community had more COVID and we've had more cases of COVID, to see the residents sick with COVID, and of course we've seen some people die. And it just drives home that if there's any other tool we're not using that is going to prevent COVID coming into the facility, like getting our staff vaccinated and protected, that we need to do this, because as you well know, the people in the nursing home setting have a lot of medical conditions. They're much frail and they're much more susceptible. The reason that, as Abby had said, what is the reason to get the vaccine? And of course, it's to protect the health of yourself, of your family, of the Bethany family, and also the community. Just do anything that we're able to do. And everybody wants to get life back to normal. And it's never going to get back to normal until we have control of this virus. And back to normal at Bethany would be just people dining together, or having summer picnics again, or the beauty parlor overflowing, the community where you can go to a restaurant or a sporting event or a concert. So we need to do our part, and if we have these tools like a vaccine that's going to help that we need to do it. Again, I would never ask you to do anything that I wouldn't do myself, and obviously I've already done it myself. Getting on to the scientific, nobody looked more critically at the data that was available about the vaccine, or vaccines that have been developed, and it was done quickly, but it was done quickly because this is the first time in our lifetime we've been in a 100-year pandemic. And so we had some of the best scientific talents available, and they really absolutely followed the minimum guidelines that you need to follow for a vaccine. Minimum guidelines are that you do the vaccine with 3,000 people, and you follow them out for about 6 weeks. What they did with the trials is they followed 65,000 people, and they followed them out for 8 weeks. And again, what they found is that it was 95% effective, which was more effective than any vaccine we've ever had. The other thing that I don't hear that talked about as much, but people say, well, how do we get this turned out so quickly? There were billions of dollars that, you think about it, if you owned a drug company and you were developing a vaccine, you would not start producing the vaccine until you knew you had the final approval from the data, even though you felt really confident that that data was going to be accurate. And what the drug companies were able to do is they had so much, millions and billions of dollars of support, that people were willing to pay to give them money for the production of the vaccine before it was even approved. Now, we all know it all got approved in the last few weeks, but they already had millions of doses of the vaccine available ready to give. The other thing that people worry about, and Abby addressed that, is a lot of people worry that the vaccine itself may expose you to the COVID virus, which is absolutely not true. What it does expose you to is a harmless protein that looks like the spike protein. So everybody knows that little ball with the spikes on, and that's what your body's exposed to, is this harmless protein that looks like the spike protein. What that protein does when it's in your body is your body recognizes that as foreign, so your body makes antibodies against that protein. So if later you would be exposed to COVID, it would remember that. It would remember that's a little protein on the spikes of that virus, and it would fight off the virus. So hopefully what I've said allays any of your fears or misconceptions. And please take this as an opportunity to get the vaccine. You're going to have the opportunity to get it way 3 to 4 months before the general population. This vaccine is only going to have an impact on the pandemic to help it control it better if we can get 70 to 80% of the population to get the vaccine. And please, we would like you all to become part of that group that would help us protect each other, the Bethany family, and our community. Thank you.